Stroke is whenever there is occlusion, obstruction of blood vessels supplying blood to the brain or part of the brain. It is called brain stroke. Brain stroke can be hemorrhagic and it can be ischemic. So what is ischemic? Whenever there is blockage in the vessel which is supplying blood to the brain or part of the brain. And what is hemorrhagic? Whenever there is rupture of the artery or vein or the blood vessel supplying blood to the brain. Both are called brain stroke. So what are the symptoms? Recognizing the brain stroke is very important, because we usually see patients coming to the hospital in the emergency. They come after 2-3 days when the golden period is gone. So what is golden period? The golden period after brain stroke happens or occurs is 3 hours, not more than 4.5 hours. So in that period you have to recognize the brain stroke and take this patient to the hospital. So how to recognize? You have to remember the mnemonic BEFAST, B-E-F-A-S-T. It's a very simple. B means balance. If you see any of your friend, member or family member is having imbalance of the body movement, imbalance movement, it can be a symptom of the brain stroke. E means eye. Eye means if there is blurring of vision or loss of vision, sudden loss of vision, can be a symptom of the brain stroke. F, there is facial deviation, facial weakness, can also be a symptom of brain stroke. A, whenever there is arm drift, means there is weakness either upper arm or to lower limbs. So both can be, or either upper limb or lower limb. If there is weakness, can be a symptom of brain stroke. And S means slurring of speech. If there is slurring of speech, can be a symptom of brain stroke. And the last one is T. If any of the mentioned symptom is present, whether it is one or more than one, you have to think that this is a brain stroke, and now the time is to call the ambulance and take this patient to the nearest tertiary care hospital. And in the hospital, what we do? We do the CT scan of the patient to differentiate whether it is a hemorrhagic or it is a ischemic. If it is ischemic, which is most common cause of brain stroke, we do the thrombolysis. We give the injection which can dissolve the clot and can reperfuse the brain blood supply. And we can salvage the brain and we can save the life of a patient.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.